Stand up, walk to the closest mirror right now, stick out your tongue, look at it. What do you see? Most people glance at their tongue and see a tongue, pink, wet, normal. They close their mouth and never think about it again. But what you are looking at right now is one of the most powerful diagnostic windows in your entire body. Your tongue reveals your circulation, your nutrient status, your nerve health, your hydration, your digestion, your immune function, and in some cases, the early warning signs of conditions that won't show up on a blood test for another 5 to 10 years. Doctors in China have been examining tongues for over 2,000 years to diagnose disease. Western medicine quietly does the same thing in hospitals every day. But your primary care doctor, in your 12-minute appointment, almost never asks you to stick out your tongue. And if they do, they glance at it for 2 seconds and move on. That ends today. I'm Dr. James Carter. I'm a cardiothoracic surgeon with over 2 decades in the operating room, and I want to tell you something I learned the hard way. Years ago, I had a patient on my table for what was supposed to be a straightforward procedure, and the surgery went sideways because of a circulation issue we hadn't caught. After it was over, I went back and looked at his pre-op photos, including a photo of him smiling for the admission paperwork. His tongue told the entire story. The signs were there. We had missed them. He survived, but that day changed how I look at the human body forever. What I'm about to show you are 7 things to look for on your own tongue tonight. 7 hidden signs that most doctors miss. And by the end of this video, you'll know exactly what your tongue is trying to tell you and what to do about it. So let's start with what I want you to do right now. Get to a mirror, a bathroom mirror, a handheld mirror. Even your phone's front-facing camera will work. Stick your tongue out as far as you comfortably can. Look at it under good light and keep that image in your mind as we go through these 7 signs. You're going to recognize at least one of them on yourself, probably more. Sign number 1, a pale tongue. A healthy tongue is pink, not red, not white. Pink, the color of the inside of a healthy lower lip. If your tongue looks pale, washed out, almost grayish or slightly white, that is a sign of something specific. Reduced circulation, anemia, or low iron stores in your blood. Here's what most people miss. After age 60, iron deficiency anemia is dramatically underdiagnosed. Your doctor checks your hemoglobin, sees a number in the low end of normal, and tells you you're fine, but your tongue tells the truth. If the tongue is pale, the tissues throughout your body are not getting enough oxygen. Your brain, your muscles, your heart. Symptoms include fatigue that no amount of sleep fixes, cold hands and feet, shortness of breath climbing a single flight of stairs, brain fog that wasn't there 10 years ago. The fix usually starts with checking your ferritin, which is your body's iron storage protein, not just your hemoglobin. These are different tests. Many doctors skip ferritin because it isn't on the standard panel. Ask for it specifically, and in the meantime, prioritize iron-rich foods like grass-fed beef, liver if you can tolerate it, lentils, and dark leafy greens combined with a vitamin C source to improve absorption. Sign number 2, a bright red tongue, especially at the tip. If your tongue is unusually red, almost glowing red, especially concentrated at the tip or the edges, that is the opposite problem from pale. Bright red usually points to inflammation in the body, B vitamin deficiency, or in some cases, early signs of cardiovascular stress. The tip of the tongue, in clinical observation, is associated with the heart. When patients come into my office with heart palpitations, atrial fibrillation, or unexplained chest tightness, I make a habit of looking at their tongue. A red tip in someone over 60 with cardiovascular symptoms is something I take seriously. The most common cause is B vitamin deficiency, particularly B12 and folate. After 60, your stomach produces less acid, which dramatically reduces your ability to absorb B12 from food. The result is inflammation that shows up first on your tongue and eventually shows up as nerve symptoms, mood changes, and cardiovascular irregularities. Have your B12 tested. The standard reference range is too low. Anything under 500 picograms per milliliter is suspect in adults over 60. You want to be in the 600 to 900 range. If you're below that, supplementation or B12 injections under medical supervision can change everything. Sign number 3, a thick white coating. Some white coating on the tongue is normal, especially first thing in the morning. But if the coating is thick, dense, almost cottage cheese in texture, and doesn't come off when you gently brush your tongue, that's different. A thick white coating most commonly points to an overgrowth of candida, which is a type of yeast that lives in everyone's body but becomes a problem when it grows out of balance. After 60, this happens for several reasons: decades of antibiotic use, long-term use of acid-blocking medications like proton pump inhibitors, high sugar intake, diabetes, or a weakened immune system. A thick white coating can also indicate digestive dysfunction, specifically poor gut bacterial balance. And here's what almost no one tells you. The state of your gut directly affects the state of your heart. Chronic gut inflammation drives chronic vascular inflammation, which drives high blood pressure and arterial damage. If you see a thick white coating, 3 things to consider. Reduce sugar and refined carbohydrates significantly. Add fermented foods like sauerkraut, kefir, or plain yogurt to your diet. And ask your doctor whether your acid-blocking medication, if you take one, is still genuinely needed. Many older adults take these medications for years longer than necessary. Sign number 4. Cracks down the middle of the tongue. Look at the surface of your tongue. Is there a deep crack running down the center? Or a network of cracks like a dry riverbed? A single shallow crack down the center is often genetic and harmless. But deep, pronounced cracks, especially with multiple branches, are a sign of long-term dehydration, nutrient depletion, or chronic digestive stress. In my experience, cracked tongues show up most often in 3 groups: patients on multiple medications, particularly blood pressure medications, and diuretics, patients who don't drink enough water throughout the day, and patients with long-term stress that has depleted their B vitamins and minerals. The fix is rarely complicated. Increase your water intake to at least half your body weight in ounces per day. So a 160-pound person drinks 80 ounces of water daily. Add a quality B complex supplement. And if you're on multiple medications, ask your doctor or pharmacist whether any of them deplete specific nutrients. Many do, and most patients are never told. Sign number 5. Scalloped edges. The teeth marks. Look at the sides of your tongue. Do you see indentations like wavy ridges along the edges where your teeth press into the tongue? This is called a scalloped tongue, and it's one of the most overlooked signs in clinical medicine. It tells you that your tongue is swollen, and a swollen tongue points to one of 3 things: hypothyroidism, meaning your thyroid is underactive, sleep apnea, or chronic fluid retention. After 60, hypothyroidism is wildly underdiagnosed in women especially. The standard TSH test misses many cases of subclinical thyroid dysfunction. If you have a scalloped tongue along with cold sensitivity, hair thinning, dry skin, low energy, or unexplained weight gain, ask your doctor for a full thyroid panel, not just TSH. You want free T3, free T4, and thyroid antibodies. Sleep apnea also causes scalloped tongues because the tongue swells from repeated nighttime oxygen drops and chronic inflammation. If you snore, wake up tired, even after 8 hours of sleep, or your spouse has noticed you stop breathing at night, this matters. Untreated sleep apnea raises your risk of stroke, heart attack, and dementia significantly. Sign number 6. A geographic tongue. Patches that look like a map. Look at the surface of your tongue closely. Do you see smooth red patches surrounded by white borders? Patches that look like irregularly shaped islands on a map? This is called a geographic tongue, and most doctors will tell you it's harmless. Sometimes it is, but in adults over 60, a geographic tongue often correlates with 3 conditions worth investigating: food sensitivities, particularly to gluten or dairy, autoimmune activity, and zinc deficiency. Zinc is one of the most underappreciated minerals for adults over 60. It supports immune function, wound healing, taste perception, and tongue tissue regeneration. Most adults over 60 are mildly zinc deficient, often because of medication use or reduced absorption. If you see a geographic tongue, try this. Ask your doctor for a zinc level test. Eliminate gluten and dairy for 30 days and see if the patches improve. And consider whether you've had any other autoimmune symptoms: joint pain, dry eyes, brain fog, unexplained skin issues. These often cluster. Sign number 7, and this is the one I want you to pay closest attention to. a purple, dusky, or bluish tongue. If your tongue has a purplish hue, especially under the tongue when you lift it, or the surface looks darker than normal pink, that is a circulation warning. Purple tongues, in clinical practice, are associated with poor microcirculation, sluggish blood flow, or in some cases, early signs of cardiovascular disease. The veins under the tongue should be barely visible and pinkish purple. If they are dark, prominent, or look engorged, your circulation is not where it should be. This is the sign I take most seriously in my own practice. Because by the time we see purple tongues in patients in their 60s or 70s, we are often looking at a cardiovascular system that has been struggling silently for years. The fix here is not a single supplement. It's the full cardiovascular picture. Daily walking, hydration, reducing inflammatory foods, managing blood pressure, and in some cases, working with your doctor to assess whether there's an underlying issue with circulation, blood thickness, or oxygen delivery. Now let me tell you about Margaret. Margaret was 72, a retired school teacher from Tampa. She came to my office for a pre-op consult before a knee replacement. Her primary care doctor had cleared her cardiac status. Her blood work was within normal limits. Her EKG looked acceptable. But when she opened her mouth to take a sip of water during our conversation, I noticed her tongue. It was pale, scalloped, and the underside had a distinct purple cast. I asked her to stick it out fully so I could look properly. I told her I wasn't comfortable with the surgery proceeding without further investigation. She was furious. She had waited months for this knee replacement. Her primary doctor had cleared her, and now the heart surgeon was telling her to wait based on her tongue. I asked her to give me 1 week. We ran a full ferritin panel, a complete thyroid workup, and a more sensitive cardiac assessment. Her ferritin came back at 12, which is severely deficient. Her thyroid was functioning at the bottom of the range, and her cardiac assessment showed early signs of right-sided heart strain that her standard EKG had missed. If we had proceeded with the knee replacement that week, she would have been at significantly elevated risk of a serious cardiac event during anesthesia. We treated the iron deficiency. We started her on thyroid medication. We worked with her cardiologist on the heart strain. 3 months later, she had her knee replacement, uneventfully. Margaret called me afterward. "Doctor," she said, "I was so angry with you that day. Now I think you saved my life." Her tongue saved her life. I just knew how to read it. Before we close, let me give you the 3 biggest mistakes people make after watching a video like this. Mistake 1. Self-diagnosing without confirmation. The signs I described are starting points for conversations with your doctor, not final diagnoses. If you see something concerning, take a photo of your tongue and bring it to your next appointment. Ask your doctor specifically about what you observed. Mistake 2. Brushing the tongue too aggressively to make signs disappear. I've had patients tell me they scrubbed their white coating off and felt better. You didn't fix anything. You just hid the signal. The coating returns because the underlying issue is unaddressed. Mistake 3. Assuming one sign means one diagnosis. The body is interconnected. A pale tongue with scalloped edges and a thick coating points to a cluster of issues, not just one. Look at the whole picture, then talk to a physician who is willing to investigate. Here's what I want you to do tonight. Walk back to that mirror, stick out your tongue one more time, and really look. Pink or pale? Bright red at the tip? White coating? Cracks? Scallops? Geographic patches? Purple under the surface? Whatever you see, your tongue is not a cosmetic feature. It is a daily report on the state of your internal health, written in real time, available to anyone willing to spend 30 seconds looking. Most doctors won't ask to see it, but now you know what to look for yourself. If this video helped you, do one thing. Send it to someone you love who is over 60. Ask them to check their tongue tonight and to text you what they saw. That single conversation could be the start of catching something early. And catching something early is the difference between a problem you fix and a problem that fixes you. Take care of yourself. I'll see you in the next one.